All right, today we're tackling a condition that really turns our whole understanding of sickness completely upside down. It's called factitious disorder. Think of it as a deep psychological puzzle that forces us to ask some really fundamental questions about why on earth someone would want to be sick. So, let's just dive right in.
And that really is the heart of it all, isn't it? It's this one single, baffling question. Why would anyone choose to be sick? I mean, it goes against pretty much every survival instinct we have. We're all driven to be healthy and strong. So what could possibly be going on here? Well, the official clinical term is a bit of a mouthful. Factitious Disorder Imposed on Self, or FDIS for short. And here's the part that's kind of hard to wrap your head around. The person consciously knows they are faking or causing the illness, but the deep down reason for doing it, that motivation to be seen as a patient, is often totally unconscious. It's this powerful internal need.
Now, I'm willing to bet you've heard of this condition by its other, more famous name, Munchausen Syndrome. It's a term that gets thrown around a lot. But do you know the story behind where that name even came from?
It's actually a reference from literature. It's named after a fictional character from the 18th century, a guy called Baron Munchausen. He was known for telling the most outlandish, unbelievable, and completely fabricated stories about all his supposed adventures. So the connection there is that element of elaborate, fantastic storytelling. The person who officially coined the term was a psychiatrist named Richard Asher, way back in 1951. He started noticing this very specific pattern in some patients who would literally go from hospital to hospital, showing up with these dramatic but totally falsified medical histories and symptoms. It is really important to know, though, that the term Munchausen isn't used as much in clinical settings these days. Because it's tied to this comical, fictional character, a lot of people feel it's kind of disrespectful, that it trivializes what is a very, very serious mental illness. And that's exactly why you'll hear the more clinical term FDIS used instead. So you can imagine, this presents a massive challenge for doctors. Trying to diagnose FDIS is like being a detective in a high-stakes medical mystery where your main witness, the patient, is actively trying to mislead you. So there are certain behaviors that can definitely raise a red flag. A patient might have this incredibly long history of hospital stays with no real diagnosis ever being made. They might be doctor shopping, jumping to a new physician as soon as one starts getting suspicious. Their medical history can be vague or just full of contradictions. And maybe one of the strangest things is that they can seem weirdly eager to go through invasive, even risky medical procedures. Now, this is absolutely crucial to understand. FDIS is what's known as a diagnosis of exclusion. That means a doctor can't just decide someone's faking. Their first job is always to treat a potential illness. So they have to painstakingly rule out every single genuine medical cause for the symptoms, no matter how rare, before they can even start to consider a diagnosis of factitious disorder. And this is where things can get incredibly sophisticated. Some of these patients have a shocking amount of medical knowledge, and they can mimic really complex disorders with stunning accuracy. For instance, by secretly taking steroids, they can produce the textbook symptoms of Cushing's syndrome. And just like that, they send doctors down this long, expensive rabbit hole of tests for a disease that isn't even there. But the deceptions can also be a lot more direct, even crude. Abusing laxatives to cause chronic diarrhea is pretty common. So is directly contaminating lab samples. Just imagine, you're a doctor trying to diagnose kidney disease because a urine sample has blood in it, when really the patient just pricked their finger and added a drop of blood to the cup. The test results are real, but the cause is completely hidden. So all of this elaborate deception just brings us right back to that one huge question. Why? Why? Understanding the motivation here is the absolute key to telling factitious disorder apart from other conditions that can look incredibly similar on the surface. In psychology, there's this concept called gain. You've got primary gain, which is the internal reward, all that attention, sympathy, and comfort that comes from being in the sick role. And then you have secondary gain, which is the external, tangible stuff. Things like getting money, avoiding work or jail time, or getting prescription drugs. And this distinction, it's everything. And that brings us to the huge difference between factitious disorder and something else called malingering. With FDIS, the goal is primary gain. The person's deep, unconscious motivation is just to be a patient. That's the end goal. With malingering, the motivation is totally conscious, and the goal is secondary gain. They're trying to get something tangible out of it. It's the difference between wanting to be sick versus wanting to get something for pretending to be sick. This table really lays out those key distinctions. See how both fictitious disorder and malingering involve the conscious creation of symptoms? The difference is the why, the motivation. But then look at that third one, somatoform disorder. Here, everything is unconscious. The person isn't faking. They genuinely feel the symptoms, but those symptoms are coming from psychological distress, not a physical disease, and they have no control over it. It just shows how fine these diagnostic lines can be.
Okay, so now that we have a better handle on the motivations, how has all of this changed in our super connected digital world? And probably the most important question of all, what does recovery from this even look like?
Well, the internet has basically provided a vast new stage for this behavior. They call it Munchausen by internet. It's when people create these really elaborate, dramatic stories of illness online, in support groups, on forums, on social media, all to get that same sympathy and attention they'd look for in a hospital. The community might be virtual, but that psychological gain is very, very real.
And there's an even more recent, and frankly, kind of wild related phenomenon called mass social media-induced illness. Now, it's not exactly the same as factitious disorder, but it's in the same ballpark. Researchers started noticing these clusters of young people, especially on TikTok, who started developing tic-like behaviors after watching a lot of content from creators who have Tourette syndrome. It's this strange intersection of social contagion, psychology, and the desire to belong, all amplified by technology. Now, treatment for FTIS is incredibly difficult. When a patient is confronted, they'll almost always deny it, and a lot of the time they just disappear and find a new doctor or hospital. The goal of treatment isn't to punish someone, it's to understand them. So the main approach is psychotherapy, trying to help the person uncover the underlying trauma or the psychological needs that are driving this deeply ingrained behavior. And all this really leaves us with a critical and very modern question. In a world where so much of our identity is curated and performed online, how do we tell the difference between a genuine cry for help and a harmful deception? That line is getting blurrier all the time. And for all of us, individuals and online communities alike, the stakes have never been higher.